What's going on, everybody? Welcome to episode 61 of the Freedom to Flourish podcast. Here today, we're going to be talking about eczema. I know we've done some episodes on some skin issues, things like that before, but we're going to dive specifically into just eczema today. So lots of really good causes that we're going to get into as to drives this issue and how to fix it, as well as some token nutrients and remedies that you can help it or do at home to help yourself. Hopefully, before you can even seek out care. All that would be great. So anyway, Dr. Joel, how are you doing this morning?
Hey, Dr. Tim, doing well. It's always glad to be here and glad to be with you. I always appreciate these times. Eczema is a big one, of course. It's one of those conditions, Dr. Tim, that if you have it, if you're dealing with it, it is just really a pain in the butt. I mean, it's really just a hindrance to life, between the itchiness, between just feeling unwell, the inflammation you can have, the dryness in your skin, things like that. And then, of course, if it gets on your hands or your face, it can just be very, very annoying and just frustrating. And so one of the things that I always share when it comes to eczema, Dr. Tim, from just a general standpoint, I know we're going to get into, talking about what is eczema, talking about the causes, how we're going to go about addressing and fixing this issue and things like that. And then, of course, we'll talk about what people can do at home to start addressing these things. But it's one of those conditions that really can be a bit more complicated, and depending on the severity, it can be really tricky to kind of heal from. But what we're going to do, of course, is go in and talk about our side of things, the clinical side of things, what we find, and we'll give the patients here, or our listeners rather, some things that they can kind of start doing today, some different supplements they can consider taking that will help hopefully begin to address things. But again, it can be very complicated. And so I always recommend working with a really good holistic doctor that's really, really good at getting to the bottom of things. It'll make this healing process so much easier. So Dr. Tim, I kind of start with that. Anything to kind of add to that? Otherwise, let's jump in and talk about what is eczema.
Yeah, let's just get into it. So what is eczema? So a lot of people will come into the office and say, oh, I have eczema. And then you dig deeper and realize they haven't really been diagnosed with eczema, and it's just more so an assumption, or it's some other skin issue. So I've seen where people just have itchy skin, and they just think just itchy skin is eczema, or they think plaquing due to psoriasis is eczema. Eczema is characterized by inflamed, red, dry, itchy skin. Oftentimes, more often than not, we'll have bumps associated with it. They can kind of burst, and more often than not with kids especially that have eczema, and they just can't help but itch all the time. They'll scratch, and you get almost kind of like that chicken skin look where it's got these red bumps, and they can bleed. And so more often than not, eczema is a little bit of scabbing over because you'll itch it, you'll bleed, and then it's got to scab over to heal. So plenty of things there that can kind of vary. So the technical term for eczema is atopic dermatitis, and dermatitis is just dermis is your skin, and then titis is inflammation. So it's just inflammation in the skin of some sorts. And just like many conditions that we talk about, it is, I would argue, a diagnosis that is slapped on something that is just it's kind of like the word idiopathic. It's we don't really know what causes it. It's just inflammation of the skin that we don't really know what drives it. So here are topical steroids, here are oral steroids, here are biologics, medications to help suppress the immune system, to calm it down, you name it. And all the things that go into addressing it from a dermatology standpoint, from at least the information that we have access to and the information that we gather from our patients and what sort of care plans they're on with their prescribing dermatologist, they are just immunosuppressive medications to calm things down. So that, later on in the episode will lead us into what causes it and how do we address those underlying issues that cause the immune system to be ramped up in the first place. So it is a lot of times just a diagnosis based off of signs, symptoms, observation, and not really a whole lot of other stuff. There is underlying testing and things like that you can do, but more often than not, it is just, hey, this is eczema. So just take these, use this cream, yada yada, see how it goes. Um, would you agree with that, Dr. Joel, or do you have a different take on that?
Yeah, no, that's good. One of the couple things I'll add to that though is that, um, like you mentioned, eczema can be one of those catch-all kind of diagnoses. Whenever someone comes in, oh, I have a skin issue, I have eczema. Well, when we look at it, it's a skin issue, but it's technically not eczema, right? And so trying to differentiate that at home can be a little bit tricky. Here's a couple tips. Number one, of course, if you look up images online of eczema, you'll see the dryness and you'll see the scaliness, and of course, it'll be red and angry. If it's just like kind of like just raised kind of red bumps without a lot of the scaliness, that usually is an example of hives, which is going to come from some kind of a histamine release or histamine issue. And then one of the things we also differentiate is if there's a ton of plaquing, like a ton of scaliness, especially when it's on like the elbows and the knees. That's more of a psoriasis type issue, which is more of an autoimmune issue. And so that's going to be fairly different. Still dealing with the immune system and the gut health, but fairly different. So, Dr. Tim, when it comes to eczema, I always encourage patients that we have to focus on the immune system and we have to focus on the gut health. And as we jump into the causes of eczema, here are the main causes that we always talk about. We talk about infections, we talk about food sensitivities, chemical exposures, we talk about vaccines, we talk about heavy metals, we talk about mold, and we talk about histamine intolerances and overall the ability to detox histamines as well. We talk about poor gallbladder function or bile flow as well, and that can contribute to a lot of things there. With the causes of eczema, Dr. Tim, we have spent a number of different episodes really kind of talking about each one of these things. And I guess what we'll do here is really focus on probably the main ones, or at least hit the main highlights here for each category. And then, of course, we'll get into kind of addressing and fixing these issues. Dr. Tim, anything you would add to that list as far as causes of eczema? And if not, let's kind of jump into, hey, what are kind of the top things that you see? Obviously, there's a variety with each patient, but what might be some of the top things that you see?
Yeah. So with this mold, we kind of just differentiated things a bit more nitpicky than I think that we could if we're being really practical about things and just trying to narrow this down. So when it comes to infections, for example, there can be topical infections like a topical like skin dysbiosis or microbiome issue, but then there can also be functional gut infections, as well as sinus infections, bladder infections, things like that, where hollow organ inflammation somewhere internally can contribute to eczema topically. So when we say infections, as well as mold, more often than not, it will take place as in some sort of hollow organ, or it'll be a topical reaction where the skin has that reaction. So infections, mold on this list, all tied together, I would argue. So with that, there is the underlying chemical issue that goes on with this. You have the infection piece, but then also the byproduct of the infection piece, which is acetaldehyde or all the mycotoxins that go with detoxifying mold. You have to deal with both sides of that. Another category, so when you say histamine intolerances, quite honestly, I would argue that food sensitivities, infections, chemical exposures, vaccines, heavy metals, mold, all those things can be attributed to histamine intolerance, or I'm sorry, histamine intolerance can be attributed to all of those things. So when we discuss histamines, what we always talk about is, you have this, pathway in the liver that can detoxify histamines. But think of it like you've got a big sink, you've got the drain, you've got the faucet. It doesn't matter how unclogged that drain is. If you have a fire hose pouring into your bathroom sink, it's going to overflow regardless. So the things that are going to contribute to the faucet being a fire hose are all the things on this list: food sensitivity, infections, chemical exposures, so on and so forth. So if you deal with those, the downstream histamine intolerance should calm down to a reasonable degree, but there are additional things that you can do to help the body process and detoxify these histamines. When it comes to heavy metals and vaccines, I would argue that those things go together, at least when it comes to vaccines causing heavy metal toxicities. Heavy metals don't necessarily have to be due to vaccines, but more often than not, when you have a vaccine issue, there is a heavy metal piece that is involved with it. At least childhood vaccines, things like that. Not necessarily as much for the COVID vaccines. A little bit different there, and you can add to this in a minute, Dr. Joel, but I don't normally see reactions with heavy metals due to that. It's more so just an antioxidant deficiency issue or a Th2 dominant issue. But anyway, so the last thing really on this list or the last two things are chemical exposures and food sensitivities. So food sensitivities, typically you'll manifest some sort of reaction on the skin or in the gut. Some people will get sinus issues if they have some sort of pre-existing sinus thing going on, some sort of infection or histamine intolerance, you name it. But typically, people will be able to identify that there's some sort of reaction internally or topically with food sensitivity. Common foods for this are things like dairy, gluten, eggs, all that stuff. And a lot of times people will think that they have a sensitivity to other foods because it irritates the gut and it causes the eczema to get worse. And so it's not necessarily a immune system sensitivity to food. It's more so a microbiome sensitivity to food. And when the microbiome becomes hyperactive, when you feed it these foods, it can then cause the immune system to hyperreact to the microbiome. So it's kind of a stepping stone, food sensitivity. And then the final thing, chemical exposures. More often than not with this, I would argue that chemical exposures are big problem because of the byproducts of infections and immune system function, like acetaldehyde, ammonia, bleach, hydrogen peroxide, all chemicals that your body will produce as a result of inflammation, infections, all this stuff, that just like with the faucet and drain analogy, at some point your drain is clogged. And if you have your drain clogged, you're not going to clear these properly. And then once that's the case, any sort of additional fragrance or cleaning product smell or even just touching any of these chemicals can cause a significant reaction topically or just any sort of reaction to the immune system. So all these things can cause eczema one way or another. And, we'll get into gallbladder function, I think, in a little bit when it more so comes to like addressing and top nutrients for eczema. But that's kind of a quick overview with these things. They're not necessarily as exclusive as our initial list can lead us to believe. But they're individual in their own way, but you can really chunk them together in some really good ways as well. So,
Yeah.
but anyway, that's my rambling on that. Plenty of things that can cause it, and I'm sure you have plenty of others to add, Dr. Joel. So why don't you go ahead and take it away?
Yeah. So that's the main core of the cause of eczema that we see. When it comes to eczema, I'll usually see a couple top issues going on. Number one is I'll usually see infections in the gut, and then I'll usually see food sensitivities result as an issue of what we call leaky gut. That's probably the most common thing that I'll see in kids. What I'll see if they develop eczema very, very early, I usually see it's due to vaccines and how the heavy metals will cause issues with the immune system, causing this imbalance with the immune system, and how it'll cause a lot of inflammation with the gut as well. So a lot of the times with adults, we need to address, again, that immune system, calming down the food sensitivities, and then address the gut health with different infections. And then with kids, it's all about detoxing the metals, supporting the immune system, and getting into the gut health as well. So those are kind of the two different kind of avenues I'll see, more so like the adults, and then more so like kids, very young, especially after getting vaccines. You covered the majority of things there. And of course, we continue to mention that there can be different components from each area here where, okay, you could have infections in the gut. And because of that, the immune system is now dysregulated. And because of those things, you're getting ran down on nutrients. And because of those things, you don't handle chemical exposure very well. So what's really interesting with that is someone might come in and they say, I think it's due to these different chemicals because I react so much. And I would generally say, well, yes, there's definitely something going on there. But my next question is, why are you reacting? Like, why is your system reacting to the chemicals? And that's where we kind of uncover, hey, there's actually a lot more kind of going on here. So, Dr. Tim, let's jump into this. How do we go about addressing this? Now, let's talk a little bit about what we do in the office here, because I think that would be helpful for our listeners. But then also, what can people start doing at home as far as addressing some of these things through nutrition, through supplements, or whatever else may be helpful, different lotions, things like that. Let's get into both of those things, what we do in the office, and then what are some things that people can start doing at home, and just kind of jump in wherever. And then we'll, of course, kind of tag team and walk through this one.
Yeah, absolutely. So at least my whole process in the office is identify whether it's gut, whether it's the immune system, whether it's food sensitivities, you name it. There's quite a few things on that list. And of course, our main mechanism of doing that is the system self-care technique, getting hands-on, muscle testing things to see where things come together, gather all those indicators, and then bark up all those trees that we see things going to. I would argue that more often than not, like you said, there's a gut thing, there's a food sensitivity, or in my opinion, heavy metal toxicity. Those are the three ones. But in addition to that, because of the dry, scaly skin, more often than not, there is a gallbladder issue that's tied into there as well. So the gallbladder is, what it does is it holds on to bile that the liver produces. As soon as the acid-rich environment from the stomach, stomach contents with the food that you're eating moves into the small intestine, it will contract and expel that bile. So then that way you can digest fat. So if you are not digesting fats properly, you're going to have dry skin. You're going to have poor fat absorption, but then you're also going to have poor fat soluble vitamin absorption. So that's where, just kind of fast forwarding to some nutrients that are really, really helpful. The top two things that I included on that list were vitamin A and fats. So butter is super important for this. Your omega-3 fish oils, super, super important. EPA, HA, all that stuff. But then vitamin A. Vitamin A is, I've seen that totally wipe out skin issues. I've seen that totally wipe out any gallbladder issues, gallbladder pains that people are having. People can go from stool that's floating from high fat content due to lack of digestion, but sinking like normal. They go from having super dry skin to having nice and moisturized skin. But it's not just limited to skin either. It is hair as well. So there's the gallbladder component that can contribute to, lack of moisture in your skin, your hair, all that stuff. But oftentimes with heavy metals, with food sensitivities, all that stuff, we'll see poor antioxidant status that contributes to dry hair, dry skin, all that stuff as well. So it's kind of a perfect storm of things that cause dry skin. The immune system can make the dry skin worse with the eczema, but a lot of people have dry skin as a precursor because of gallbladder issues, and then the immune system just makes it worse. So anyway, how do we address these things? Well, first, we got to balance the immune system. So I encourage all of our listeners today to go and listen to our immune system podcast, where we talk about that Th1, Th2 balance, where Th1s are involved in fighting off infections, Th2s deal with environmental issues, just like all the things on the list that we have discussed that cause eczema. When Th2s go high, Th1s go low, your immune system becomes hyperreactive. And that's where issues like eczema come in. That's where food sensitivities can get worse. That's where gut issues or mold toxicities can get worse, or at least the immune system's reaction to it. And histamine intolerance gets worse. It's just that the immune system is so overwhelmed with all this junk it has to deal with that it'll start to indiscriminately, react with things. So it's this tricky balance of, well, we got to handle all the stress that's pressing each ones, but then also deal with all the things that are pulling up on the Th2 side, which is everything that we're kind of talking about today. So to do that, well, if it's a food sensitivity, well, figure out which food it is, and then potentially do some antihistamines or things like that to calm that down. Things on that list are things like quercetin, camu fruit. What else we got? Vitamin A, that's a great antihistamine. All those are great. But then when it comes to, say, like vaccines and heavy metals, well, there's antioxidants like glutathione, superoxide dismutase. Those are great. But then metals, a lot of times things like aluminum or things like mercury from fillings in your teeth, all those heavy metals work in balance with other metals that are found in our bodies. So mercury and selenium, for example, when mercury is high, selenium tends to be low. And the more selenium you have, it will actually help chelate that mercury out of there and bring it down. And so if there's that balance there, you can actually help detoxify these heavy metals. At the same time, antioxidants are really, really good at doing this too. But as far as it goes for gut infections, mold, all those things, that's where there's a pretty hefty list of antimicrobial herbs that we will often recommend in the office that will determine using the muscle testing. Those herbs include things like astragalus, Chinese skullcap, noni fruit, neem, seal, golden thread, all of your berberines, really, as well as plenty other herbs that are really, really good at clearing this stuff up. Not really worth getting into just the whole extensive list, but cleaning those up and identifying all those things and going about it from the gallbladder standpoint, the immune system standpoint, the gut standpoint, you can really, in the office, identify what's causing this. And if you stick with it, things typically do calm down in a pretty not so timely manner. It's not like eczema should be something that takes 6 months to fix. If you figure out what's causing it, it shouldn't take all that long to deal with it. So anyway, that's the list, at least for the office. Dr. Joel, if you have anything to add to that, go for it. If not, why don't you walk us through some things that you would recommend at home that some people start with in order to get all these things rolling, as maybe like a supportive thing.
Yeah, absolutely.
There are a ton of underlying immune system things going on.
Yep, absolutely. So to start, I always share with patients that for those that aren't super familiar with muscle testing, applied kinesiology, or systems healthcare, these techniques are things that we're doing in the office with patients to test your nervous system and actually very quickly and efficiently get to the bottom of, okay, what's actually going on here, number one. And then number two, what do we need to do to fix it? Is there a nutrient, a supplement? Is there an herb, a lifestyle component, a dietary component we need to change? And so when we jump into things this way in our appointments, between our history, between the muscle testing and just overall clinical understanding of how the body functions, we're usually able to address these things very specific. Like Dr. Tim mentioned, this isn't something that should take months and months and months to heal. Generally, it should take more of like 1 to 2, maybe 3 months compared to 1 year to 2 years and that kind of thing. Now, I will say that some of the most intense cases I've seen of eczema, some of probably the heaviest cases, have taken up to 4 to 5 to 6 months to really heal. But I will say part of that depends on compliance as well. So if there's different food sensitivities and it's like, hey, we really need to take a break from those, and patient maybe takes a break like 60% of the time, it's like, okay, well, to some extent we're going to be just moving very, very slow. So compliance is super important. So after we go through the history, we jump in. What are the top things that I usually find with that? Well, I've shared a little bit about those, but for the patient listening at home, here's some things that you can do to start addressing the eczema. Number one, we generally always see food sensitivities with this issue, either as one of the root issues of the eczema or just something that is impacting this. So I usually encourage people to take a break from gluten, take a break from dairy, and make sure you have all the different inflammatory seed oils out of your nutrition, out of your diet. All three of those things generally are, number one, it's feasible. It's not necessarily easy, but feasible to get those things out of your nutrition diet. And they're generally things that are contributing to inflammation. And so it's always a good idea to start there. If there's other things that you also react to, I've had patients that have major soy sensitivities. I've had some that have chocolate or coffee sensitivities. If there's something there that might, flare it up after you eat it, then I would say take a break from that and take that pressure, take that inflammation off of your system. Number two, I would say consider the list, like the causes of eczema we've talked about, right? So if you've gotten vaccines, chances are you need to consider detoxing heavy metals, right? If you have a lot of gut issues, bloating, gas, diarrhea, constipation, chances are, hey, there's probably some kind of infections going on in the gut health. And that's where I'd recommend, hey, go ahead and watch our videos on gut health, on different infections, and continue to, start addressing those things. If you know you have mold, then obviously you want to address that. That's going to be extremely important. If you're not even sure exactly what mold is or what to look for, we've got an episode on that. Would definitely encourage you to go listen to that. So we've got a couple things, but essentially you kind of have to put your own detective hat on and kind of think through a few things. When did this start? Okay, what might be some of the causes or the root issues here? And really kind of thinking about day to day, like what impacts it. Stress is always going to impact and worsen eczema because stress is always going to impact your immune system and your gut health. It's just when you have the eczema, it's a very prominent issue with your skin. So a little bit of stress, you're going to see it pretty easily. So there's another thing that we haven't so much touched on, but it's obviously very present. So the nutrition, avoiding those things, handling stress. Okay, what does handling stress look like? Well, we've talked about this quite a bit, especially with a lot of our cortisol topics. But making sure your nutrition is solid, whole foods, staying away from processed stuff. That's kind of the one of the first steps. I would say movement is very helpful as well with stress. Working out, getting steps in, going on walks is super, super key. I encourage people to get anywhere from 8,000 to 10,000 steps a day. If you can do 15 or 20,000 steps a day, that is amazing. That would be so good for you. So the nutrition, the movements, managing stress, making sure to get good sleep, all those things are very, very important. When it comes to supplements, there's a couple things that I will see pretty commonly that people need that have eczema. So vitamin A is definitely at the top of the list. The source of that, remember, you don't want to get a beta carotene source because it doesn't convert super well to being activated, but you want more of like a palmitate. The brand that I use here in the office is Biotics, Biotics Research. It's called BioAE Forte, I believe is what it is. That can be super helpful. Fats, Dr. Tim, you mentioned fats. And so to kind of add to that, grass-fed butter, of course, we always talk about that, getting about 2 tablespoons a day for adults. And then another one I've seen pretty commonly when there's a lot of inflammation is the need for EPA, which is essentially found in fish oil supplements, and grass-fed beef. So while you should be eating grass-fed beef often, if not every day, EPA is going to be found very heavily, obviously, in fish and then fish oils. So if you do a fish oil for EPA, you want to make sure that the ratio is pretty significantly higher than DHA so that the absorption is there and is optimal. A lot of fish oils, when you look at them, they'll have EPA and DHA. You want to find one that's going to be either a 3-to-1 or 4-to-1 ratio with EPA to DHA. So the one I use is from Nordic Naturals. It's called Pro EPA. It's got, I think, roughly 850 milligrams EPA to, I think, like 200 some DHA. And so you want a ratio similar to that. Quercetin, like you mentioned, Dr. Tim, and Camu are huge. And then a couple other ones I'll see are things like zinc. I like to use zinc chelate from Standard Process. Zinc is huge with healing the skin in general, and then it's also very important with detoxing. So zinc, couple other just antihistamines and just overall nutrients that support methylation would include 5-MTHF, choline, and then TMG, which I'll use Beta Food from Standard Process for that oftentimes. And so those are kind of the top things there. Dr. Tim, I feel like a lot of times with different conditions like eczema, we kind of have so much overlap between like, here's the things that you can start doing at home, nutrition supplements, and then also remembering that, hey, there could be still a lot of other things kind of going on. And so for the listener, if there's confusion or it seems like we're being kind of vague, that's not necessarily the intention. But our hope is to be able to kind of cover both areas, but then also talk about and cover kind of where they overlap with things. So, but I think that's kind of I think that's pretty much all that I have there with the eczema. Dr. Tim, do you ever recommend any specific diets with eczema, or are you usually finding that it really depends on what the root issue is and then going after with supplements and lifestyle changes?
Well, that's exactly it. I mean, yes, I do recommend specific diets, but it's specific, as in specific from case to case.
Yeah.
So, say the gut is involved. If it's a large intestine overgrowth, it'll be an antifungal diet or an anti-amoeba. If it's overgrowth in the small intestine, that'll be a low FODMAP diet. If it is, say, like a primary food intolerance, sensitivity, allergy, whatever you want to call it, then specifically avoiding that food is important. But then, through the testing that we do in the office, if someone has an issue where they're just not tolerating, say, like vitamin B2, iron, a couple other vitamin minerals, things like that, due to an overgrowth in the gut, I'll recommend stay away from probiotics. I'll recommend that they stay away from multivitamins or iron supplements for the short term. It's very, very case by case basis, essentially. So if just like you said before, if you have a gut issue that triggers it, well, figure out what foods provoke that. If it's just a whole bunch of foods that are just a bunch of vegetables and grain and all that, it could be that you just need to try low FODMAP. If it is just a dairy, well, maybe you have a dairy sensitivity. Could be a lot of different things. So it's hard to say. Like you said, we don't try to be vague with our podcast episodes, but I always say we struggle to speak in definitives because there's so many things that it can be. It's not just talking about it on a podcast will give us, or allow us to say, hey, this is exactly what's causing your problem. The whole point is to educate you as this is the list of things that we see in the office, and these things that we can see help those problems. But each that we put on the list of causes, there's about 8 things for each cause that could fix it at that point, or if not even more, and other things that you have to do to deal with that root cause as well. And that's why correct me if I'm wrong, or just give input as to whether you think differently. But most people arrive in our offices because they've tried all of the at-home stuff, and you feel like they just can't connect the dots because there's a specific cadence with solving issues that more often than not you have to follow in order to get there. Because say it is a gut issue, well, if you try to do all these parasite cleanses and all this stuff that's popular online, if you don't deal with the acetaldehyde toxicity that comes with that, well, it's not going to go away. If you deal with heavy metals or food sensitivities, chemical exposures, histamine issues, and there's a huge ammonia detox issue, and you don't deal with that, it's not going to calm down. So you have to deal with the byproduct of all of these immune system dysfunctions in order to actually get them to go away. It's kind of like the smoke in the house fire. If you can't see the actual embers that are burning off the background after you put the fire out because the smoke is in the way, then they could potentially reignite at that point. So you have to deal with the smoke as well as the embers and the flames. It's not meant to be non-specific, but it can be a lot of stuff. And unless we actually have a good, thorough history and exam on a patient, we can't make that decision for you. But outside of all of that, the only thing that I wanted to continue to, or only other thing that I put on that list for top nutrients, remedies, things like that, that I've seen to be really, really, really helpful. There is a topical cream from a company called Apex Energetics. It's called Oxycell, and it's called Oxycell SE, the sensitive version where it doesn't have any essential oils or anything like that for scent unit. It is a topical antioxidant cream that can be really, really good at calming things down and moisturizing. So I've seen that help really well. Psoriasis, eczema, dry skin, you name it. And so if you are experiencing eczema and you're looking for something that's not corticosteroids to try to at least get some relief, I would encourage you to look into that one because it can be very, very, very helpful. And I've seen it totally wipe things out. More often than not, when it actually clears the problem and it wipes it out, it is in conjunction with doing some oral glutathione or antioxidants, and that's the issue that's testing in the office. But if you're just looking for something that can make you feel better and not steroid, it's a really, really, really good option as well. So the main active ingredient is glutathione, which is the strongest antioxidant in your body. So it helps regulate that Th1, Th2 balance. But then also, if you're needing to clear histamines, it'll help clear those. If you've got a hormone issue, it'll help clear that. If you have What else? If you have heavy metal toxicity, it'll help chelate those metals and help clear them out. So basically all the things that we've talked about, it helps with. Now, if it's topical, it'll help the local reaction and not as much internally, but it is on the list, so it can be helpful. So um, anyway, get your gallbladder
Yeah.
right, and then deal with the immune system, and your eczema should be gone.
Yep.
Or try to
That's
make it
good.
super simple. Balance the immune system, heal the gallbladder, eat lots of fats, you'll be good to go. So that being said, Dr. Joel, do you have anything else to add, or can we wrap this thing up?
Yeah, a couple other quick kind of bullet points with things. A lot of patients ask what they can use topically, right? So you can get the steroid creams from the store over the counter or from your doctor as a prescription there. And one of the things that I share about that is, number one, it's going to help with the inflammation. It's going to help with the dryness and all those things. But please understand that this is definitely a Band-Aid, right? We have to address the gut health. We have to address the immune system in order for your body to heal your skin and to get rid of your eczema. While the creams are helpful, I usually don't see, Dr. Tim, I'm curious if you have any thoughts on this. I usually don't see a ton of like side effects with using the cream. The main issue I usually have with it is just that, hey, this isn't necessarily addressing the root issue, right? And so if you need it just for the short term while we're healing the internal side of things, then that's important. But other than that, we want to make just to understand that that hey, we've got to address the internal stuff. Do you see any significant side effects or negative aspects to doing the steroid cream?
There's always the risk of like withdrawal syndrome, where the skin stuff is really, really worse if you become heavily dependent on it.
Yeah.
I haven't personally seen that. I have seen where when patients are doing a whole slew of medications and topical creams, stuff like that, that we will find a primary medication toxicity where steroids do test for that. So yeah, I have seen that. Is it common? No. So I try not to get too much into cross-checking things like that. But there's ways that we can allude to that issue with the muscle testing. A certain combo of nutrients that will test detoxify that, and using that information, we can decently assess that there is some sort of medication toxicity. So I've seen that. Do I see a lot of downstream effects because of it that are really significant? Not really.
Yeah.
More so, it just is another thing that the body has to detoxify when it's already full of other junk it needs to detoxify. So
Yep. Yeah. That makes
nothing too
sense.
serious.
Yeah, the steroid withdrawal I've seen as well, but that was after, someone's been using it every single day for months, right? 2, 3, 4, 5, 6 months. And so, what about other topical things? I mean, the Oxycel is a great recommendation. Coconut oil sometimes can be helpful. Beef tallow can sometimes be helpful. One of the things I try to encourage people with is to use a more natural type of lotion. And stay away from all the other lotions that you generally will get from the store that have all kinds of parabens and phthalates and all kinds of other chemicals in them. So coconut oil and beef tallow can sometimes be helpful. Whenever someone asks and I give that recommendation or suggestion, I always kind of follow it up with, it may be helpful, but the most important thing is we've got to address the nutrition. We've got to address the internal health. And that is going to give you so much more relief than generally anything you can put on your skin, especially long term. Okay, a couple other things. Serotonin is extremely important for healing the gut. So while we talk about the gut health, we talk about different herbs for infections. One of the things that you'll see as you come across different content from us, whether it's our podcast episodes on the gut health or YouTube videos or whatever it is, serotonin is extremely important. A lot of times, yes, we'll find the different cofactors like zinc and B6 and 5-MTHF and magnesium and stuff like that to help make serotonin. A lot of times we'll find a need for an herb called St. John's wort as well. And that can be extremely helpful with supporting overall the communication in your gut and then overall just the healing of your gut. One of the things too, I'll encourage people to do is go on YouTube and look up different eczema testimonials and just listen to what has helped other people. I think that can be very encouraging. But then number two, I think you'll also see a number of different patterns and different perspectives. And so that can be helpful as well. Two things that can generally really help eczema that I don't hear a lot of people talking about. Number one would be bentonite clay. So this isn't the bentonite clay that this isn't the powder you're going to put on your face. This is bentonite clay as the supplement form that you're going to put into some water and you're going to drink. Can be a very good kind of binder and help with detoxing the gut and things like that. I don't actually find that it muscle tests a ton, but I know from personal experience and with some other people that having that as kind of part of your kind of treatment plan there can be helpful. Along with bentonite clay, fasting is extremely, extremely helpful. One of the things that our gut needs in order for it to heal quicker and faster is a break from food. Our gut is constantly wanting to heal itself, but while we always have food going through, it's going to be a little bit more difficult because your gut's always working to digest those things. So fasting, that could be a 24-hour water fast. I've had patients do fasts with just water and raw milk. I've had some patients do it for 2 days, 3 days at a time. I've had some that do it for like a week at a time. And that can be very, very, very helpful, especially with chronic issues. The last thing I'll mention about eczema is it can take time. Mainly if you're addressing this on your own, it can take time. So if you start changing nutrition, you start on supplements, don't let yourself get down after 1 or 2 weeks when the eczema has not significantly changed. Remember, the skin takes roughly 30 days to fully replenish itself and replace itself. The gut, some people say, can take up to 2 to 6 months to fully heal itself. We generally find that those timelines are much shorter when we're working with patients because of our approach and so forth. But just understand that in general, it can take time. And especially if you're working on it just kind of by yourself, it can take time. So be patient. Chances are you've had the eczema for quite a while. It can take a little bit of time to heal, but your body can do this. All right, Dr. Tim, that's all I got. Thanks for enduring there with me. A couple of last things I wanted to mention. Dr. Tim, anything else to add? Otherwise, let's go ahead and wrap up.
Yeah, let's just wrap it up. So I'm Dr. Tim Augustyniak, Flourish Functional Wellness Center down in Bentonville, Arkansas. If you have any questions, comments, concerns, suggestions for future episodes, feel free to reach out. My website is draugustiniak.com. It's DRUGUSTYNIAK.com. If you want to find me, all my contact info is there. Top of the page is all the links to my socials, as well as all my contact info, email, phone number, all that stuff for the office is at the bottom. So definitely out.
Awesome. And I'm Dr. Joel Miller. The practice here is Freedom Health and Wellness in the DFW, the Dallas, Texas area. You can find me online at drjoelmiller.com. You can find me on most socials just looking up Dr. Joel Miller. Guys, thanks so much for listening. We hope this is helpful. If any questions arise, definitely feel free to reach out and let us know if there's any way we can help you. We've got a couple guests coming up over the next couple of months here, and we've got some other exciting topics coming up as well, and we're excited to bring those to you guys. All right. Thanks so much, guys. Hope you're having an awesome week, or you're about to have an awesome week. Hope you had an awesome weekend, and we'll talk to you guys soon.